in 2010. And on that note, there's an update to the complex procedure used on heart patients who are extremely ill. The device, called the Impella, takes over blood circulating duties of the heart. And Dr. Robert Jumper is the co-medical director at St. Vincent's Medical Center's vascular program. Dr. Jumper just performed this Impella procedure on a patient whose heart was only functioning at 15%. To me, that sounds like somebody who doesn't have much time left.
No, and in fact, this patient was critically ill. With the pump function being so low, his organs were not getting the adequate blood flow to keep them sustaining their normal circulation. And as this continued, he would have started to lose function of his kidneys and possibly even blood flow to his brain. With using this procedure, we were able to do the procedure to revascularize his heart and bring blood flow back to his heart muscle to return the heart muscle function back to a normal functioning level.
You have an example of this left ventricular assist device. We want to see it. Now, this is the newest, one of the newer versions of it. This has been around for a while, but it's gotten better.
Yes.
Describe.
Before, when we used these devices, we used to use it with an external pump drive, and the cords or the drive lines that used to go into the patients were the size of a garden hose. At the present iterations of these models, we now are able to place this through a needle stick in the groin section and then thread it up to the heart to pump enough blood to maintain the heart function while we do critical procedures on the patient's hearts.
And it's very thin.
It's tiny. It's about 4 millimeters in diameter, so it can fit up through the arteries, which are the iliac arteries, in the majority of patients. The sheathing system, which is the delivery system, is a little larger than the catheter itself, so the patients do have to have adequate conduits in order for us to get to the heart to place this catheter. And
here's an example of how it works. Go ahead, walk us through.
Sure. So this is the catheter which is being placed over a wire into the left ventricle. Once the wire is removed, we can start the catheter, and in the inlet section, it pulls blood to the outlet, which is on the other side of the aortic valve. This motor housing here allows the blood to be pulled from the ventricle and placed in the aorta, thus relieving the actual work that the heart has to do. So if someone has a squeezing function of 15%, they don't have to work as hard to get the blood into the circulation. It takes 50% of the blood out of the chamber without the heart having to do it on its own.
Is this a temporary fix?
This here is a temporary support device. Now, we can leave these in for up to 4 to 5 days. Usually during that period of time, however, we have taken the steps to revascularize the patient, either by open heart surgery or, in this particular case, we did it with a stenting technique. So at the same time that I had placed the catheter, I was able to then replace the patient's blood vessels with stents, which would alleviate the blockages which are present, and thus the heart was given the opportunity to begin functioning at a higher level on its own.
This has got to be risky at every move, though, especially on that patient.
Doing these procedures is somewhat complex. The placement of the catheter, when you first start placing the catheter, is somewhat time-consuming and difficult in placement. The last procedure we did, we were able to do it with a single operator, myself, and the procedure was complete in about 15 minutes in placing the catheter in.
That is unbelievable. Is there ever a patient you want to go in with this on, but you're just afraid that's going to be the last straw?
Typically, it's the reverse. It's the patient who has no other option, who has no option for open heart surgery or bypass surgery because they're just too sick. They don't think they could get them through the procedure, or someone that doesn't have the circulation to their heart muscle, that you believe that if you go to fix that last vessel that is bringing blood flow to the heart, you're actually going to cause more damage than good. With this device in place, it allows us to do the most complex procedures on those patients without them ever having any fluctuation in their blood pressure or their heart rate. So they remain completely hemodynamically stable throughout the procedure and just several years ago, we were unable to do these procedures because the patient would be too sick.
You strike me as the right person for this job because you're very relaxed. I sense that when you're doing the procedure, you must be very relaxed, like maybe saying a prayer or two.
Yeah, it's the nature of the situation that you're in.
Thank you so much, Dr. John, for St. Vincent's Medical Center.